Thank you, Mr. Chairman. So we're here today to talk about PAPA, the framework for our response to all sorts of emergencies, natural disasters, accidents with hazardous materials, terrorist attacks, pandemics, you name it. So I returned just a few days ago from a trip to Puerto Rico, and I know some of my colleagues have also been to Puerto Rico recently. And during my trip, it was clear that nearly 4 months after the storm, the crisis in Puerto Rico is a daily reality for tens of thousands, hundreds of thousands of people. So Dr. Kadlec, you're the top official in charge of preparedness and response at HHS. What is the biggest thing you've learned from the situation in Puerto Rico and the U.S. Virgin Islands about how we need to strengthen our preparedness and response capabilities?
Well, thank you, ma'am. I think there are a couple of levels to go here. One is improving the resilience of our innate hospital healthcare structure. That's one area. The other thing is really the resilience of our public health system, which is a separate piece but related piece. In Puerto Rico in particular, there were in initial stages after that terrible devastation that literally devastated the whole island and every life was touched. It was very difficult for the local public health and medical infrastructure to stay. There are some incredible heroic stories of doctors, nurses, laboratorians who basically responded, public health officials who left their families, left their houses in disarray, and basically went to respond to help their neighbors and their communities. But I think that's one piece of this that needs to be addressed, what happens before the storm. The second piece is how quickly can we move in. We had deployed teams to Puerto Rico, advanced of both Irma and Maria, to be available once the storm passed, both storms passed, to basically respond quickly. But even so, with the level of devastation, that was a huge piece of it. And a huge piece of it was the lingering devastation, not only the loss of communications and electricity, but also the damage to the ports and the airfields that limited some of the movement. So I think one of the lessons learned was you want to go in aggressively before the storm if you can, and we literally put people's lives at risk from our response teams, including people from Massachusetts One, that responded to all three storms. They're great people, and again, representative of your constituents from other states around the country that responded. But also there's a piece of this that we have to somewhat remove some of the dependencies in the responses, seeing how we can move quicker and faster, if that's possible. A lot of it was dependent on being able to transport through air or barge. Again, responding to an island is a tough one.
So I appreciate this, and I'm glad we're trying to think about what we need to do and what we need to do better, and to acknowledge heroic efforts, but we need a better structure here. But to apply these lessons, we also need good data. You know, we need to know not just what we got right or what we got wrong, but when we got it right, when we got it wrong, by how much, and what kind of difference it would make on the ground. One of the things that struck me during my trip last week was how sketchy the data are. So, for example, I met with the federal and Puerto Rican officials at FEMA's field office, and they said, no more issues with potable water. No waterborne diseases, all the water is drinkable. And I asked this specifically, you turn on the taps, you hold a glass under it, the water will be drinkable, is drinkable everywhere on the island. Sounds great. Not so much, though. I met with the Massachusetts State Police volunteers who told me they'd observed raw sewage in the water. At the Public Health Center that I visited in Louisa, they said they still don't have potable water, no drinkable water for their patients. And they said they serve 100,000 people and that none of them have drinkable water. We heard the same kind of contradictions when it came to statements about how many people lacked power. So, Dr. Kadlec, I get that public health emergencies are really challenging circumstances, and it's hard to get good data. But how do HHS and other agencies collect data in a way that is reliable so that you can deploy your resources effectively, hold yourselves accountable to get the job done that needs to be done?
Well, ma'am, we learned a lot from the experience in Puerto Rico and trying to rectify that. Because of the loss of communications, cell towers and the like, the ability to get information either from local authorities or local hospitals or clinics was practically nil. We literally went to the point at one time to basically use runners from the National Guard who would have satellite phones to basically go to hospitals and clinics and report information out. But that's a major consideration and lesson that we're still learning that we have to address, because it's a major shortfall. Because if you were to add, again, a terrible event like this, a terrible earthquake or a nuclear or radiological event, you could imagine that the circumstances would even be more challenging. But that's an area of great, intense concern, quite frankly, and work that we have to do.
Well, I'm very concerned about this, and I don't have time. I'm out of time now, so I can't ask Rear Admiral Redd and Dr. Gottlieb about their work in Puerto Rico. But Senator Cassidy and I sent a letter to Chairman Alexander, signed by 7 other members of this committee, asking for a hearing on the recovery efforts in Puerto Rico and the U.S. Virgin Islands, and I hope we'll be able to hold that hearing. You know, Puerto Rico might not be in the front pages anymore, but it is a humanitarian crisis, and we have a moral and a constitutional responsibility to exercise oversight responsibilities here. Thank you. Thank you, Mr. Chairman.